Okay, you guys. Well, I am just going to go ahead and get started so I can be mindful of your time and respect that time because I know it is of value. So, really quickly, I am so grateful that you guys are all jumping in here. We have a couple more coming in. That's awesome. So, welcome, welcome to everyone. I'm going to share my contact information in the chat box. So, please feel free to look and connect with me via email, through the website. And also, I sent a booking link if you would like to schedule a private conversation, 20-minute check-in, just talking about what you're going through. I am going to offer that for you guys because this is such a heavy topic today. And if this is stirring a lot of emotion for you, I want to offer a space for you to be able to talk and process that. And then I can, from there, point you in the best fit direction based on what your situation is. So that's just a little bit there. And if you have confidential questions or private questions, you're welcome to email me, or honestly, the best way is to send me a private chat in the chat box there. You can just send it confidentially and privately to me, and then I would just answer that question generally without using anybody's names. So please feel free to do that as well if you'd like. Okay, I think we're just going to go ahead and jump right into the content of today's training, which is all about how to cope with anxiety and depressive symptoms. Okay, let me get this slideshow started. If you guys could text in there a thumbs up that you can hear me okay and that you can see my screen, because I'd sure hate to go on and on if it wasn't working correctly, right? Okay, I'll wait till I get a thumbs up here. Awesome, thank you. Perfect, thank you for that, Angie. Okay, so again, this is a heavier topic today. We are going to be talking about depressive symptoms and anxiety symptoms and how to cope with those. So I kind of want to give a caveat and let you guys know that we aren't going to be talking about those that are diagnosed with major depression disorder or generalized anxiety disorder, for example. We're just going to be talking about those of all of us that can have symptoms of depression or anxiety. So that's a big difference we'll be talking about in the conversation today. But please know if this is triggering anything for you, if this is causing you any discomfort because maybe you have a loved one that's dealing with it, or you personally are dealing with something we talk about today, again, reach out, whether that's to me or to someone else you're working with or whoever. Okay, just try to be sure that you'll promise yourself that we want to make sure that first and foremost that you are taken care of emotionally and mentally, okay, and physically, of course, too. Okay, so let's dive right in. I'm excited about this training because it is all about mental health. And if you know me, that is one of my very big passions, is to overcome the mental health stigma and increase mental health awareness. So the goal isn't to get rid of all of these negative thoughts and feelings. That would indeed be impossible, correct? But the better goal is to change your response to them. So we can't stop feeling them, but we can change how we react to them. And that's what we're going to be talking about today. Okay, so first and foremost, if you all have heard a presentation from me, I am sorry that I feel like it's I've had, let's see how many presentations in the last couple of weeks with the city, so I'm so grateful for that. But I also know that there's sometimes new people who haven't heard from me, so sorry about this being redundant if you have heard, but I'll make it quick and short and sweet. So my name is Becky Lauritsen. I am a licensed professional counselor, and I am the founder of IOMI, the very proud founder of IOMI. I love my job. And I'm also trained in EMDR, and we can talk a little bit more about that if we have time, or if you have questions, just know that I'm a resource for that. A couple fun facts about me is I'm a wife to a handsome cowboy. We live out here in northern Colorado. It is actually Nunn. I don't know if anybody knows where Nunn is, but it's a little bitty town over here just east of Fort Collins. We have two beautiful girls. I'm a mama to Briar, who is about to be 6, and Bristol, who is going to be 2 this December. So I'm the one that has all the birthdays and everything. My birthday, my husband's birthday, and the 2 kids are all in the holiday season. So wish me luck, okay? Okay, So I am crazy passionate about increasing mental health awareness. And this is part of that passion, is to be able to talk to people in a larger group like this and be able to chat with them chat with you guys and just talk about the warning signs and overcome the stigma, right? And just normalize what it looks like to get mental health counseling or to get support. So just so you guys know, I think that that is important part of what my mission is here with IOMI and with what I do. And then a little fun fact for you, I'm country girl through and through, and I was back in 2003, which is sad that that was that long ago. I was the world champion barrel racer for the Little Britches Rodeo Association. So kind of a fun fact. If you want to jump in and share a fun fact about you, I think that's always a ton of fun for each other, to get to know one another. And we can go from there. Cool. Okay, moving right along, you guys. I think it's important for you to know more about my business model, because honestly, then you will know where my heart lies in what we do. So it is a self-care membership program. Actually, it's called IOMI. So it's an IOMI instead of an IOU. And our purpose is to create guilt-free self-care. A huge part of that is the mental health counseling. So that's what we do. All the trained supporters within IOMI, we tackle the mental health concerns, the life coaching, business coaching, health coaching, things like that. And then we partner with those that are experts in the other areas. So I know I'm not an expert in nutrition or fitness, but I will partner with those that are experts and I will send them their way. And so that's a ton of fun. Okay, so that is a little bit about what we do. I am very passionate about the truth of that self-care is preventative care. I believe that with my whole heart. All too often as a licensed counselor and then working in as a leader in sales, I would see over and over again these people coming into counseling or coming in to get support after their breaking point, right? And so often I would see, and even my own story, I would see so many indicators that said, if we would have intervened here, at the beginning, when these first symptoms started to show up, we could have prevented so much devastation, so much heartache, so much hurt. We could have prevented that. So I believe we can do that through quality self-care and consistent self-care, mental health counseling, the uncomfortable self-care, accountability, connection, just all of that. I believe that that is the bigger purpose. And really that's where IOMI comes into play, is that we're taking a preventative approach to our mental health, just like so many places do with their physical health. So that's a little bit about me. Okay, and I don't know if anyone's can make sure that they're muted, just because then that way there's no background noise, and then I will absolutely open it up to questions towards the end as well. Thank you, guys. Okay, so just a little bit of an overview. We're going to define, I think it's important to know what we're talking about. So we're going to define depression and anxiety. We're going to talk about the different symptoms of both. And then we're going to dive into those coping skills and actually leave you with some tangible tools that you'll be able to walk away with to be able to implement right away if needed. So first things first, the definition of depression. So the depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also known as depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. Okay, so that's kind of the I'm like the umbrella terminology, just kind of the all-encompassing definition of depression. And then I also wanted to just share with you, as a licensed counselor, we have to abide by the DSM, the diagnostic statistic material. And so that is where it gives us the criteria to actually diagnose somebody with major depression disorder. So I'm just going to briefly go over that a little bit, just so you guys can have an idea. And then honestly, for you to start thinking like, yeah, I do have 5 of these, and I want to be able to give you some tools to know what it is that we're looking for. So the DSM-5 outlines the following criteria to make diagnosis of depression. So without this, we can't label anybody with depression. I know that term is tossed around often. Oh, he or she's just depressed. I'm just depressed. No, it actually has some very particular criteria to follow. So this individual must be experiencing 5 or more symptoms during the same 2-week period, and at least one of these symptoms should be either depressed mood or loss of interest or pleasure. So quickly, these are the 5 that you have to, or these are of these, you need to meet 5 of them. So depressed mood most of the day, nearly every day. Marked diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when not dieting, or weight gain or decrease or increase in appetite every day, nearly every day. A slowing down of thought and a reduction of physical movement observable by others, not merely subjective feelings of relentlessness or restlessness or being slowed down. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt nearly every day, diminished ability to think or concentrate or indecisiveness nearly every day, recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or suicide attempt or a specific plan for committing suicide. So I imagine that most of us could look at this list and think, yeah, there's definitely periods of my life, maybe even a 2-week period, that I have had a loss of energy nearly every day, right? Or, honestly, I'm really bad at making decisions. So the diminished ability to think or concentrate or indecisiveness, that happens to me, right? That could also be the fact that we're moms and working and trying to juggle so many things, right? So, but the biggest piece for you guys to know is that it has to be 5 of those criteria for a period of 2 weeks and nearly every day, most of the day, okay? There's other types of depression, right? I won't go into all of those, but I just wanted to list some for you guys. So there's the disruptive mood dysregulation disorder, major depression disorder, persistent depression disorder, premenstrual dysphoric disorder, substance medication induced depression disorder, and depression disorder due to a medical condition. And then there's other and unspecified depression disorder. So just so you know, that's kind of the insight on an actual licensed counselor when we are reviewing and going over our client and assessing whether or not they would fit into that criteria. Okay. And then there's the definition, the encompassing definition of anxiety. It's an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. People with anxiety disorders usually have reoccurring intrusive thoughts or concerns. They may avoid certain situations out of worry. Okay. Again, taking it a step further to the DSM diagnosis. So when you, assess for GAD, which stands for Generalized Anxiety Disorder, clinical professionals are looking for the following: the presence of excessive anxiety and worry about a variety of topics, events, or activities. Worry occurs more often than not for at least 6 months and is clearly excessive. Okay, pretty important pieces there. The worry is experienced as very challenging to control. The worry in both adults and children may easily shift from one topic to another, so it doesn't have to be just about one thing in particular. The anxiety and worry are accompanied with at least 3 of the following physical or cognitive symptoms. And if it's for kids, it only needs to be 1 of these. So edginess or restlessness, tiring easily, more fatigued than usual, impaired concentration or feeling as though the mind goes blank, irritability, which may or may not be observed by others, increased muscle aches or soreness, that's that physical, the psychosomatic effect, and then difficulty sleeping due to trouble falling asleep or staying asleep, restlessness at night, or unsatisfying sleep. Okay, so again, there's different types of anxiety. Anxiety disorders really encompass a lot of different and more specified disorders as well. So some of them can be generalized anxiety disorder, separation anxiety disorder, selective mutism, specific phobias, social anxiety disorder, panic disorders, agoraphobia, substance medication induced anxiety disorder, an anxiety disorder due to a medical condition, and then again, other or unspecified anxiety disorders as well. Okay, that's a lot, right? Whew, I know that's kind of feels like a whole lot of information. But again, I hope you were kind of taking a mental note of like, okay, yes, no, okay, I don't think it's nearly every day, or maybe, man, it is. Okay, that's what we're here for, and that's what we're going to be talking about together. Okay, I'm just going to try to make sure I check in with the chat box. Yes. Oh, great point, Christine. Absolutely. And that's going to be the key, because if you have the kind of that medical, right, it could be anxiety disorder due to medical condition, that would be part of the conversation. Absolutely. So there's always room for digging deeper, better understanding, and really a lot of self-awareness there. So that way, if one of us in particular knows, okay, I have this concern, I have this health concern, so my blood pressure is going to already be heightened, you're taking that into consideration. Yeah, I love that. Thank you very much, Christine. Okay, so then there is adjustment disorder. So this meme is funny, yes, but it's also sad because 2020 and the stressors that we have encountered this year can definitely increase those symptoms, right? The worry, the intrusive thoughts, this restlessness, um, the constant state of stress, right? Losing interest in activities. So there's so many things that can be happening. So an adjustment disorder is the development of emotional or behavioral symptoms in response to an identifiable stressor occurring 3 months of the onset of the stressor. So again, it could be related to COVID-19. It could be related to the job loss because of COVID, because of the riots, because of the fires, right? Because of the election coming up. There's so many things that we're faced with this year that you may have been like, yeah, I have that symptom, and the other symptom. But if you don't have it longer than, again, we're looking at that 6 months for actual diagnosis, then there can be such thing as an adjustment disorder. Okay, which is okay. There's nothing, again, we're just overcoming the stigma of these labels, if you will, quote unquote labels, and we're going to be better educated in them, right? Okay. There we go. So you may have seen some commonalities between the two, and I think the terms oftentimes get just mixed up, right? Or used together, right? Depression and anxiety. So I think it's important to recognize that there's two different, that there's some, it's important to recognize the difference between the two is what I'm saying. Now, a lot of times it's that people with anxiety can also develop depression, and people with depression can also develop anxiety. So roughly about 50% of people diagnosed with depression also can be diagnosed with an anxiety disorder. However, it's important to get an accurate diagnosis in order to treat the correct conditions. So again, that's where you bring in the professional, your doctor, your therapist, somebody to really give you a thorough exam and assessment to make sure that you're treating what it is that you're experiencing. So many people with depression may experience what is known as anxious distress in addition to their low mood. So people with anxious distress often feel tense, restless, and have trouble concentrating because they worry so much. They are deeply afraid that something bad is going to happen or that they might lose control of themselves. People who experience anxious distress with depression may be at a higher risk for suicide or self-harm and may need more intensive treatment. So it's important to identify these symptoms along with depression. Above all, it's important to remember, again, to let a doctor or mental health professional evaluate you to see if your symptoms meet these criteria. So again, that's my disclaimer. Now we're just going to go over some of the generalized differences and symptoms from here on out, okay? So the symptoms of depression are, of course, a depressed mood, lack of interest in enjoyable activities, increase or decrease in appetite, insomnia or hypersomnia, slowing of movement, lack of energy, feelings of guilt or worthlessness, trouble concentrating, and can be suicide or self-harm thoughts and behaviors. Okay. So like I mentioned, for a true diagnosis, a person has to have experienced 5 or more of those symptoms for at least 2 weeks, and it needs to be abnormal for them as well. Okay, and we'll, that's really where you get that one-on-one conversation with a doctor or therapist to dissect that further. And then the generalized anxiety disorder, some of those symptoms are excessive worriness, restlessness, being easily fatigued, trouble concentrating, irritability, sleep disturbance, muscle tension. Okay. So again, if you've experienced those types of symptoms most days more than 6 months, then that's when, and they're causing distress. I like this kind of caveat. They're causing distress, and they're disrupting your day-to-day life. So they're interfering with what you would normally need to be doing in your day. Okay. So if you compare these two lists, you can see that there is definitely some overlap. Sleep problems, trouble concentrating, and fatigue are all symptoms of both anxiety and depression. Irritability may also manifest in both, right, in place of low mood. There are, however, some distinguishing features. People with depression move slowly and the reactions seem to be flattened or dulled. People with anxiety tend to be more keyed up as they struggle to manage their racing thoughts. Another distinguishing feature is the presence of fear about the future with people with anxiety. Anxiety is fear-based, okay? Depressed people who do not have anxiety are less likely to be fraught with worry about the future events, as they are often resigned to believing that things will continue to be bad. So it's almost like they're more depressed. People with depressive symptoms are more concerned about what has happened, right? They're looking in the past, they're looking backward, when people with anxiety symptoms are typically fearful of the future, right? The worries that they can look forward to. Does that make sense? Okay. Just message in there if you have any questions. So when we look at these kinds of symptoms, I think it's important to kind of take it a little bit step further here and identify the 3 types. Perfect. Thank you, Amanda. The 3 types of symptoms that we have, no matter what the emotion is, no matter if it's depression, no matter if it's anxiety, burnout, stress, anger, doesn't matter what the feeling is and emotion is, we have 3 different types of reactions to them. Okay, so then there's the physical. So that's going to be feeling physically tired, drained most of the day, lowered immunity, frequent illnesses, frequent headaches, muscle pain, change in sleep habits, right? So if I'm over here feeling really sad, a lot of these physical symptoms are going to be present, or some of them, I should say. Okay, and then we have behavioral symptoms. So if I'm feeling sad, then behaviorally, I'm going to start withdrawing from my responsibilities. These are examples. I may isolate myself from others. I may procrastinate, taking longer than I usually would. I may turn to self-medicating, right? Using food, drugs, or alcohol. I may have poor attendance, showing up late, leaving early. Those are those behavioral reactions, right? And then the emotional. These are fairly obvious, right? Sense of failure or self-doubt, feeling helpless, trapped, and defeated. Detachment, feeling alone in the world. Loss of motivation, negativity, increased cynical thoughts, decreased satisfaction. So I think that's good to recognize that there's the 3 different types, and to ask yourself, how is this affecting me physically? How is this changing my behavior? And how am I feeling emotionally, right? And again, having that conversation with yourself or a loved one, and also with a therapist or a doctor if needed, is going to help you be able to problem solve this. So Let's all take a deep breath, right? That's a lot. That's heavy. And so I want you to take a moment, whether it's right now, you can just take a quick second and reflect. Did you relate to any of these symptoms? Have you ever in the past experienced any of these symptoms? Or do you know loved ones that are experiencing any of these symptoms? And I just want to put this out there too. Obviously, I am a licensed professional counselor and I have ethics to abide by. And so if one of you were to come to me, if anyone comes to me and says, I'm feeling depressed and I have suicidal ideation and I have a plan and whatever, if I had any indicator that somebody was in danger, then I am mandated to report. And that is for the betterment of each individual, right? That is to keep people safe first and foremost. So just know that. And sometimes that's helpful to know because then you can get the support that you may need or your loved one may need, but just wanted to make sure you all are aware of that. Okay. So take a second and think back to this question. Are you depressed? Maybe you take a moment after our conversation today, or maybe this evening or first thing in the morning, and you journal about this. Which of these symptoms have you experienced before? Or was there a season in your life years ago maybe that you experienced this? Okay. And if you had any indicators of yes, that you have experienced this, you are not alone. So just some statistics to throw at you about who is affected by depression. So major depression, depressive disorder affects approximately 17 million American adults, 7.1 of the US population age 18 and older in a given year. Major depressive disorder is more prevalent in women than in men. 1.9 million children, 3 to 17, have diagnosed depression. Adults with depressive disorder or symptoms have, I can't read, have a 64% greater risk of developing coronary artery disease. Okay. Pretty alarming, isn't it? The most alarming part about those statistics is that the majority of people are not getting support and they're not getting reported, right? And so those numbers in realistic terms would be much more higher. So the best part about this whole thing is that 80% of those treated for depression show an improvement in their symptoms generally within 4 to 6 weeks beginning of medication or therapy or attending support groups or a combination of those treatments. It doesn't have to be all of those. It could be one or all of them. 80% are showing an improvement. That's pretty exciting if you ask me. And it can take 4 to 6 weeks, absolutely. Yeah, sometimes it's definitely having to take patience, absolutely. So despite its high treatment success rate, nearly 2 out of 3 people who do suffer with depression do not actively seek nor receive proper treatment. Oh, that one makes me so sad. And that's truly a big part of my mission is to simplify this process, to overcome the stigma, to make it easier for people to access mental health. An estimated 50% of unsuccessful treatment for depression is due to non-medical compliance. So whether that's patients that stop taking their medication too soon, due to the side effects, financial factors, fears of addiction, and/or short-term improvement of symptoms, right? So they have a little bit of relief, and then they get off the medication or they stop going to therapy, and then that leads them to believe that continuing the treatment is unnecessary when indeed it is. And then participation in this patient-to-patient support group improved treatment compliance by almost 86% and reduced inpatient hospitalization. That's pretty awesome. Support group participants are 86% more willing to take medication and cope with their side effects. So when they are together, again, connection, it is that much more effective. Okay, moving right along. So when we talked about the definition of anxiety, again, taking a moment and reflecting, are you anxious? Did you relate to those symptoms? Have you ever experienced those symptoms before? Do you have loved ones who are experiencing those symptoms now? Okay. Again, maybe take some time and explore that and dive deeper. Talk to someone who you trust. Okay. Because you are not alone if you said yes. Anxiety disorders are actually the most common mental illness in the United States, affecting 40 million US citizen adults age 18 or older, 18.1% of the population. That's a lot. Anxiety disorders are highly treatable, yet only 36% of those suffering receive treatment. People with an anxiety disorder are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety. So not only are they struggling with the current symptoms of anxiety, but their likelihood of going and having worse symptoms, right? More detrimental side effects, if you will. Anxiety disorders develop a complex set of risk factors, including genetics, brain chemistry, personality, and life events, as we can imagine, right? So same thing, treatment for anxiety. There is treatment out there. Anxiety disorders are generally treated by psychotherapy, medication, or both. There are many ways to treat anxiety, and people should work with their doctor or therapist to choose the treatment that is best for them. Only 1/3 of those suffering from anxiety disorder actually receive treatment, even though the disorders are highly treatable. Again, let's overcome this stigma. In addition, according to the World Health Organization, 1 in 13 globally suffers from anxiety. The WHO reports that anxiety disorders are the most common mental health disorders worldwide, with specific phobia, major depression disorder, and social phobia being the most common anxiety disorders. So a phobia is part of, underneath that umbrella of anxiety. Okay, so that's where we can bring in mental health counseling, right? As you heard, my purpose, I believe, in my business is to create a preventative approach to our mental health care, right? To overcome the stigma. Mental health is definitely uncomfortable. I am not going to argue with you. It is not easy, right? Because by definition, that means without effort. And it takes effort, I promise. I've been there. I've been a client that has received mental health counseling. And then, of course, I've been there seeing my clients struggle with coming to counseling, because it is not easy, but it is simple. Okay. I believe truly that we can prevent depression, anxiety, self-harm ideation, so many of these symptoms. I believe that we can prevent that with early intervention. Right? I want to start the conversation with somebody when they start to notice indicators of depressive symptoms, or when they were on the verge of a panic attack, right? Talk to a therapist now in order to process this. And the most beautiful part about our brains is we can rewire those thought patterns, right? So knowing that you guys are with the city of Fort Collins and you have EAP benefits, take advantage, right? Take advantage of the resources that you do have available to you, whether it's the EAP, whether it's IOMI, maybe it's a private pay counselor out there, whatever it looks like. Just try to, recognize the importance of intervening early. Okay, so let's jump into coping skills. This is how we can start to intervene on top of course, the mental, on top of the counseling, the psychotherapy, medication management, if needed, absolutely. There's a space for that 100%, but I will make a little caveat that I believe that we have to make sure that we are going to therapy if we are taking medication, especially new. Like if we are just getting on an antidepressant, then I think it's really critical that we are going through therapy as well as the medication management too, okay? Because I don't want whatever the underlying issue of the depression to get swept under the rug, because I'm grateful that the medication is helping and desensitizing that. but I would much rather get to the root problem. And then that way, my hope would be that you may not need it. Okay. Great question. Yes, we are able to help with military services. I have one therapist in particular who specializes in military. Her husband is active and has done a lot with military too, so she's very sensitive and aware. So that is something I would be happy to talk to you more about, Melissa. Great question. And it sounds like Christine has a great resource too. Okay. Get back to my notes here. Sorry, guys. Oh, thank you. Okay, so coping skills. There are nearly infinite ways to cope, right? And we all use the methods that suit our unique personalities and needs. An activity that causes stress in one individual might help another person cope. Isn't that funny? So it doesn't matter whether you cope like everyone else. The important thing is that you find an effective coping method that will help you thrive and build resilience. Okay, so coping is a thing that we all do, whether we do it consciously or without thinking about it. It's something that we do. That might mean watching a funny movie when you're sad, calling a friend to help you wake through a breakup, going out for a drink after a challenging workday. All of these are forms of coping skills. Some of these are going to be healthy and build resilience, while others are going to be destructive or unhealthy, right? And so we're going to talk about healthy ones today. So we've kind of categorized these based on Blake Flannery's master list of coping methods into these categories. So one is a healthy diversion. So kind of the distraction, if you will, a healthy one. So it could be writing, drawing, painting, photography, right? Getting creative, playing an instrument, singing or dancing, taking a shower or a bath, gardening, taking a walk or go for a drive, watch television, play a game, go shopping, clean or organize your environment. That's not fun for me, by the way. Read, take a break, or go on a vacation. So I know you're probably going to look at this list and be like, I can't do those things. Like, I have no time for that. There's no way that I'm able to do that. I get it. I get it. And I respect that. But also, pick one thing. Okay, it sometimes feels like it has to be this all or nothing, but I promise if you can just start with one. So as I go through a pretty in-depth list, just jot down the ones that you're like, oh yeah, I haven't done that in a while. I bet that would be fun for me. Okay, don't be thinking about having to implement all of these, because just honestly, that would be probably more stressful than not. Okay, then the next category is social interpersonal coping skills. So talk to someone you trust, right? Again, therapist, excuse me, or a loved one, a family member, a best friend, a best colleague, but it has to be someone you trust and can rely on, and that you feel confident can carry the things that you're dealing with, right? Because I think that it's fair to say we all have those friends who we go to and we say, I am feeling so frustrated and sad, and I've really just been feeling pretty depressed lately. And then they turn around and say, oh, me too, and blah, blah, blah. And then they make it all about themselves, right? Yeah, make sure that you go to someone that will listen, okay? And let your voice be heard. Deal? Set boundaries and say no. This is one of my favorites. Write a note to someone you care about. Be assertive. Use humor. Spend time with families and or friends. Serve someone in need. Care for or play with a pet. Role play challenging situations with others. Encourage others. Some great social interpersonal skills. Cognitive, so the thought processes. Making a gratitude list is one of my favorite things to do when I'm feeling in that funk, if you will, or feeling stuck. Brainstorm solutions. Lower your expectations of the situation. Honestly, I think often we have way too high of expectations on ourselves personally, right? And so make sure you're giving yourself realistic expectations. Keep an inspirational quote with you. Be flexible. Write a list of goals, right? Take a class. Act opposite of negative feelings. Write a list of pros and cons for decisions. Reward or pamper yourself when successful. That's one of my favorites. Write a list of strengths. Accept a challenge with a positive attitude. Physical coping skills, sleeping, eating healthy, getting into a good routine, eat some chocolate. I love that they added that one. Limit your caffeine, right? Practice deep, slow breathing, exercise or play sports, engage in basically when you can scream in a pillow, right? Punch a pillow. Just let it all out, cry and laugh. Catharsis. Okay, so spiritual. So then being able to, whatever that looks like, if you believe in a greater power, greater good, whether that's God or whether you believe in the energy, the vibrations, Buddha, I don't know, whatever it is, get connected to that greater good by praying or meditating or just being out in nature. Get involved in a worthy cause, give back. That's such a great way to be, to cope with what we're dealing with, right? If possible. Limit yourself, right? So drop some things that you are involved in. Prioritize important tasks. Use assertive communication. Schedule time for yourself. Say no. Again, no can be a complete sentence. And of course, you'll know my soapbox is self-care, right? You deserve the best because your loved ones deserve the best of you, not what's left of you. So if you're experiencing some of these symptoms, early intervention symptoms, remember when you are able to address that, it's not only for the betterment of you, but you're able to protect your loved ones by bettering yourself, right? And so quickly, I'll go over this. I've trained on this before. But there, I think, is an important piece of this is that we know the difference between self-care and self-indulgence. And I think that's a great example of an unhealthy coping skill that we lean on way too often is that self-indulgence piece. So indulgence is characterized by doing or tending to do exactly what one wants, especially when this involves pleasure or lacking control. Okay, so this is going to be binging Netflix all day when you know that that's not healthy for you, right? It's going to be scrolling mindlessly on social media when there are so many negative things that can be triggering you on social media. It could be sitting down and eating the entire box of chocolate instead of just having that one piece, or drinking the entire bottle of wine instead of one glass. Does that make sense? Sure, it feels good in the moment, but in the long run, it's going to leave you feeling very sick, probably, right? Or defeated, drained, headache, blurred vision, all of it. And then there's quality self-care. This is the practice of taking an active role in protecting one's own well-being and happiness. So again, not only are you protecting yourself by practicing quality self-care, by doing that, you're protecting your loved ones as well. And so those examples would be going to counseling. It's a little more challenging, right? Takes a little more effort, but it's the thing that's going to add so much value to you in the long run. Okay, waking up early, getting your exercise in, meal planning, meal prepping so you can get your healthy, nutritious meals in. Saying no, delegating, right? Journaling. All of these are great examples of self-care, quality self-care, the IOMI's definition, if you will. Okay, another piece of this that I think is important that we talk about when we're talking about anxiety and depressive symptoms is the ability to connect. Now more than ever, is there a need to connect? I recently did a training on overcoming loneliness, and it's really fascinating if you were to look at the studies and the statistics of what loneliness does to us physically, emotionally, and honestly, more physically, the symptoms, the detrimental symptoms that we can experience from feeling lonely. Okay, so here are some ideas to just reach out to connect with one another. I know we are limited and this looks a whole lot different than it did this time last year, but we can figure it out. Now's the time to figure it out because unfortunately we've been in this situation for a while and my hope and prayer is that it will be over with tomorrow, but I think we can all agree that it probably won't be. And so we need to figure out how we can make this work. How can we connect on a regular basis? So reaching out to those that you love, be more sociable with your coworkers. That's a great way to connect. Be intentional about it, right? Ask them how they're doing. Have an in-depth conversation, if you will. Limit your contact with negative people. This was very powerful for me when I actually did this. So take an inventory. When you leave a social event or a meeting or something of the sort and you feel drained and exhausted and angry and irritable and all the things, then recognize that how much of that you have control over. Is it the type of people? Are they negative? Are they bringing you down? Okay, reassess that. Connect with a cause or community group that is personally meaningful to you. Again, giving yourself an opportunity to give back. One thing in IOMI is we actually hold you accountable to what that giving back looks like. So whether it's the Santa toy drive with Realities for Children that we're going to be helping with this year, or being able to get creative and giving you an easy way to connect and just help others, right? Finding new friends, expanding that social network, again, looks a little different now. And then also being able to connect with a therapist, because that's what we love to do, is to give you a sounding board to connect with somebody. You can do that through your EAP, right? Or through IOMI or whoever that needs to be. Okay, so the piece of this that I want to give to you, the tangible tool that I think would be helpful if you were to walk away with and implement, is this toolkit, if you will, emotional regulation safety plan. Okay, so the idea of this is that you would do this with a support person. So you would, whoever that is, whether it's your husband or your wife, your best friend, your mom, your therapist, you're going to fill this out together, and you're going to fill it out for you. So you're going to recognize, what are your warning signs that are indicating that you're feeling more stressed out or depressed or anxious, or you're having those fearful thinkings. Like, my warning signs are pretty obvious to me now. They're going to be, I'm more short and irritable with my family. The minute I start snapping at my kiddos for things that I normally wouldn't, I'm like, okay, what's happening? When's the last time I took a break? When's the last time I, checked out, or, whatever it is that I needed? Maybe you're self-medicating. Maybe you're withdrawing and not doing the things that you once would normally do. So you're going to write down those warning signs. Okay. And then you're just going to look at the situation and ask yourself, what do you have control over and what do you not have control over? This is a critical question we ask ourselves these days. To be a little more transparent, my sister is in the middle of the troublesome fire over there by Granby and Grand Lake. As of the last I heard, so right before this meeting, she is, her house is still standing, but she has had to evacuate with her two little kids, and you can imagine how emotionally stressful that is. I'm feeling it for her. I can't imagine what she's actually going through. And so that's a critical space where we have to ask ourselves, what do we have control over in that? She did everything she could as far as sprinklers and digging a trench and watering as much as she could, tearing down any old timber, things like that. And then being okay and knowing what we don't have control over. We don't have control over the wind or when the moisture comes. So again, that's just one example. Okay, and then from this list that I shared, identify your coping skills to implement in order to decrease whatever the negative emotion is, to decrease the depressive symptoms, the anxiety symptoms. Okay, so for me, my very critical, non-negotiable coping skill is waking up before my kids wake up and having my first cup of coffee in silence. That is my favorite thing. That adds so much value to me, right? Maybe for a lot of you, it's going outside and running or walking or working out, or maybe it's calling a best friend. So you're going to look at that list and you're going to write down the things that work for you. Okay. And then, of course, I put on this sheet if there's any emergency information. So maybe you write down your counselor's phone number, you call your doctor, there's the crisis number there. And of course, if anyone is ever having any unsafe thoughts, or if you are in immediate danger, if you know someone in immediate danger, then